name is Haley, and in this video I'm going to be breaking down the Brief Cognitive Rating Scale. So the BCRS was developed in 1984 by Dr. Barry Reisberg and Dr. Stephen Ferris. The test stages the severity of cognitive and functional decline in older adults, and it does that by lining up with two other tools from the same research group, which is the Global Deterioration Scale, or the GDS, and the Functional Assessment Staging Tool, or FAST. So instead of giving you one overall score like a lot of screening tools, the BCRS breaks cognition down into 5 separate axes, and it scores each one on a scale of 1 to 7, and those scores map onto the same 1 to 7 stages that are used in the GDS and the FAST. The BCRS is designed for older adults being eval'd for cognitive decline. This includes people in the community, long-term care facilities, and inpatient or outpatient geriatric settings. It is most responsive in patients who already have a noticeable decline or signs and symptoms of dementia, rather than as a first pass or earlier intervention screener in a general population. It takes about 15 to 30 minutes to administer. No special training or equipment is required beyond the test form itself, so it's completely free to use. There are 5 axes. Axis 1 is concentration, things like counting backward or subtracting from serial 7s. Axis 2 is recent memory. Can the person recall today's meals, current events, their phone number, stuff like that. Axis 3 is past memory, so childhood teachers, schools, personal history, anything that targets that long-term memory. Axis 4 is orientation to time, place, and identity. And then Axis 5 is functioning and self-care. Everything from managing finances down to help with like dressing, feeding, hygiene, which is often scored using information from a caregiver or an informant rather than the patient directly. Each axis is scored independently on that 1 to 7 scale, and the average of all the 5 is what will line up with your overall GDS stage. You would reach for the BCRS when you already suspect a dementia process and you need to stage it. Figure out how far it's progressed rather than when you're doing a first screening for cognitive impairment. It pairs naturally with the GDS and the FAST because all 3 were built to be used together. It's also useful for tracking change over time, since axes 1 through 4 can be readministered multiple times in the same day if needed, but axis 5 needs several days between administration for like a fair, accurate reading. What I liked about the BCRS is the axis by axis like structure, how each one is independent, but all together gives you a really good picture. It's not just a single number. You can see exactly where the patient is struggling. It also has really strong stats behind it. It's like the inter-rater reliability and the validity, and it has really good internal consistency across all of the axes. What I didn't like was kind of in the same branch is that it hasn't been revalidated pretty much since it was made in the recent decades. So it leans heavily on, and also that it leans heavily on informant report for axis 5, which can be difficult because it introduces like subjectivity. So that's something you have to navigate. And then it really isn't built for earlier mild impairment. You have to have it with a moderate to severe presentation, so you're kind of limited at that point. So yeah, that's the big picture of the BCRS. All right, thank you. Bye.